For a better understanding of this new variant, we are now being joined by Michael Linial, a professor of computational biology at the Hebrew University of Jerusalem. Professor, thanks so much for joining us on WION at this hour. My first question for you, the latest findings from the Netherlands say that the Omicron variant may not have been first found in Africa, but in Europe. What do you have to say about that?
I would say that it's probably not the case, and the reason I'm saying it is that the latest report from Netherlands showed that a couple of days before the first announcement of from South Africa, there were already people in Europe that had this specific variant. The reason is probably that those people have been took flight before the very famous one that came from South Africa. So the real question is now to investigate whether those people have been in Africa, let's say 2 weeks before they were identified. So the question is still open, but it seems that it still came from Africa, but spread to Europe earlier than we thought.
Right. Now, Professor, several vaccine makers have expressed skepticism about the efficacy of the current vaccines on the new mutated strain. But the big question is Omicron capable of breaking the current vaccine barrier?
Everybody knows that we are still lacking a lot of information. But what we know as of now is the following. First, which is very important, that people that were vaccinated have between light, very light, and mild disease. So for sure, it seems like people that were vaccinated are well protected. Whether they cannot be infected, it seems that they can be infected. However, they do not develop, as of now, very severe disease. It means that it might be the case that this new variant is capable to infect even very effectively. However, its many mutations maybe also affect the severity of the disease.
Right, Professor, but what about the booster doses, which are of course being discussed globally as of now? How essential are they when it comes to protection from the new variant?
Everybody that, at least I can say in our country, that were infected by these viruses, many of them were already got the booster, namely the third shot. So it seems that there are two waves that are going on. One is the reduction in protection after vaccination, and the booster brings it back to its optimal level. So definitely, I would say even more severely, that people that have been vaccinated many months ago are by far less protected. Even for this virus or any other virus, like the Delta and so on. So reduction in vaccination is a global phenomenon that needs to be addressed by the booster. It has nothing to do with the Omicron specifically.
Professor Linial, thank you so much for all those insights, and thank you for joining us on WION at this hour. WION World is One is now available in your country. Download the app now and get all the news updates on the move.